My name's Jane Higgs and I'm an instructional designer here at IOSH. We've recently launched our Managing Occupational Health and Wellbeing course, so I just want to give you a little bit of insight into how we've created it. We worked with a lady called Christina Butterworth, and Christina helped us to put a course outline together. From that, we were able to create a great set of learning outcomes. And learning outcomes are really important because they help us focus on what we want a learner to know, to do and to understand from going on the course. And the whole point of the course really is to build confidence and competence really, and ultimately make people better people managers. Learning outcomes also help us to understand how we're going to assess, because learning outcomes always have to be measurable, so they do help us with that end process. Once we'd got the learning outcomes, we were able to put the course content together, and we based it on a 4-segment model that Christina had given to us. So that 4-segment model was a healthy company, health risk management, fitness for work, and then finally wellbeing. I remember talking to Christine particularly about the wellbeing one, and she was really keen that we didn't focus on wellbeing as being what she called fruit on Fridays. So that last segment in particular is all about what wellbeing actually is and how it adds value to an organisation, and how do you know that your wellbeing programme is a good one, that it's going to work and it doesn't kind of fizzle out really. So once we've established all of that and we'd started to write the content, we were very keen on making sure that there was some great learning interventions in there. So people, it didn't matter what your learning style was, there was something in there for everybody. So we've packed it with lots of discussion opportunities, lots of interaction. There's a great quiz in the first section, which has some quite astounding facts in, but I'm not going to give you any of them because obviously that will spoil the training, but there's some surprising things in there. We've also got a case study that the learners will work through, and they'll put together their own health risk assessment. Some good videos as well. We've sourced a great one from the World Health Organization. It has some great feedback about that. So it's all based about encouraging best practice and looking at things in a fresh way, being proactive in the workplace. One of my favourite activities really is when we just simply get learners to ask, how are you? Because that's one of the things that can sometimes feel a little bit uncomfortable for people to do if they're not used to it. And then, we move on to being able to recognise when the signs of people aren't quite as well as you think they are and how you deal with it. Got a great workbook for the course, as with all of our Irish courses. It's full of great tips, it's full of everything that you learn in the course, so hopefully people, it won't be left there when they've been out of the training room. They'll get back and they'll pick it up, flick through it and think, I learned that on the course, what was that about? So hopefully it'll carry on to be useful. From the trainer perspective, because everything we do as well is for our training provider network, it's a great set of training notes. So it includes everything that you need to run the course. It's got a shorter presentation because what we're trying to do is encourage facilitated learning. So the presentation just guides you along really. And I always say, if you want to run a great course, get an Irish course and just add a great trainer. So really that's all that it needs. Finally, I'm really proud to have worked on the course, and I know it's going to make a really positive difference to health and wellbeing at work.